Hello, my name is Jessica Smith, and the topic that I was assigned was non-acute care. During this presentation, I'm going to be talking about non-acute care facilities in Mandeville, including public health clinics, nursing homes, home health agencies, rehabilitation services, and psychiatric facilities. The data I used to collect this information were personal interviews and government and agency websites. During this presentation, I'm going to be talking about non-acute care facilities in Mandeville, including public health clinics, nursing homes, home health agencies, rehabilitation services, and psychiatric facilities. The data I used to collect this information were personal interviews and government and agency websites. First, I want to talk about some of the public health services prevalent in Louisiana. These include fighting chronic and communicable diseases, monitoring the food residents eat and ensuring that there is safe drinking water, allowing access to preventative health services, including screenings, checkups, and patient counseling, ensuring access to vital records, including birth certificates and death certificates, analyzing public health data, and ensuring that we are prepared for natural disasters or any threats. There are 63 public health units in Louisiana, although there is only one in Mandeville. The public health unit in Mandeville primarily focuses on the environmental health of the community, and the hours of operation of this unit are Monday through Friday, 8 a.m. to 4 p.m. The Mandeville Environmental Health Clinic focuses on identifying chemicals in the environment that could cause adverse health effects, evaluating the extent of human exposure to chemicals and how it will affect their health, making recommendations for prevention and reduction of exposure to hazardous chemicals, and promoting public education on the health effects of chemicals in the environment. Another focus of the Mandeville Environmental Health Unit is to work with healthcare providers, state and local agencies, and residents to develop strategies to address the environmental health concerns in their community. The next non-acute care facility that we are going to talk about is nursing homes. Now, community level data for the number of nursing homes in Mandeville was unavailable due to avoidance of disclosing data of the individual companies. However, it was found that there are 38 facilities in St. Tammany Parish. It was also found that there are 250 to 499 employees working at nursing homes in Mandeville. The largest nursing home in Mandeville is Heritage Manor. They provide services of long-term care, skilled nursing services, physical and occupational therapy. This facility operates 24 hours a day. Its licensed bed capacity is 145 beds. Its occupancy rate as of October of 2021 is 70% capacity. The average number of residents served on a daily basis is 95 to 100 residents. The residents range from 50 to 100 years old, and white females make up the largest demographic at this facility. The most common diagnoses found in this facility include congestive heart failure, chronic obstructive pulmonary disease, heart failure, cerebrovascular accidents, diabetes, and dementia. There are 95 employees staffed at this facility. This facility utilizes a van and bus to allow for the transportation of residents. An electronic health record system is utilized at this facility to allow for documentation. Residents are billed through insurance at Medicare allowable rates for these services. The next non-acute care facility is home health agencies. There are 6 home health agencies in Mandeville, and there are 162 employees working for home health agencies in this community. A first name basis is one of the home health agencies in the Mandeville community. They provide services such as assistance with activities of daily living, light housekeeping, meal preparation, medication reminders, and companionship. The type of personnel who work for this company include home health aides, certified nursing assistants, licensed vocational nurses, and professional caregivers. A first name basis employee is available to any patient 24 hours a day, 7 days a week. Payment options include Medicaid or private insurance, and the largest demographic includes the elderly and veterans. The next non-acute care facility that we are going to talk about is the rehabilitation facilities. There are 5 rehabilitation facilities in the St. Tammany Parish with 271 employees working at these facilities. The Fontainebleau Treatment Center is a rehabilitation facility that serves the Mandeville community. They provide services such as mental health services, developmental disability services, and gambling addiction services. They also provide prevention therapy. The personnel who work at this facility include licensed counselors, licensed nurse practitioners, registered nurses, and medical doctors. The demographic of this facility includes males. The women are actually placed at the alcohol and drug unit, which is also in Mandeville, although it is a different facility. The Fontainebleau Treatment Center served 3,198 outpatient and 212 residential patients in St. Tammany Parish in 2020. The budget for this facility in 2020 was $22,518,188. The hours of operation of this facility are Monday through Friday, 8 a.m. to 4:30 p.m. The Fontainebleau Treatment Center provides services for residents of the Livingston, St. Helena, St. Tammany, Tangipahoa, and Washington parishes. Another non-acute care facility includes psychiatric facilities. There are only 3 psychiatric hospitals in St. Tammany Parish, but within those 3 hospitals there are 671 employees. The North Lake Behavioral Health System is one of the psychiatric facilities that serves the Mandeville community. The services they provide include psychiatric inpatient treatment programs, adult intensive outpatient programs, partial hospitalization programs, and adolescent psychiatric inpatient treatment. The licensed bed capacity for this facility is 140 beds, and the personnel working for this facility would include clinicians, therapists, and psychiatrists. The types of payment that the North Lake Behavioral Health System accept include Preferred Provider Organization Insurance, Health Maintenance Organization Insurance, Medicaid, and Medicare. Also, this facility is open 24 hours a day, 7 days a week. Throughout research, I have found 3 main problems within the non-acute care facilities in Mandeville. The first one being the lack of care for uninsured people. Without insurance, the services at non-acute healthcare facilities are very expensive, and the inability for people without insurance to pay for services results in a deterrence of care, which can be severely harmful for their health and well-being. Secondly, is the fact that these facilities are understaffed, especially due to COVID-19. These facilities being understaffed is resulting in a reduced therapeutic environment for patients, impediment in patient-centered care, and a burnout in healthcare personnel. Lastly is the lack of transportation. Of all the non-acute care facilities researched, the only one that provides transportation for residents was Heritage Manor. Thus, people who have no mode of transportation are inhibited from receiving care despite needing the services provided. Throughout research, some strengths and opportunities of this community regarding non-acute care facilities include the Medicaid expansion in 2021, which allowed 617,709 people to acquire affordable, quality health care in Louisiana. This allowed for people who generally couldn't afford health care to obtain health care to have the opportunity to receive the physical and mental services needed at an affordable rate. Also, it was found that access to health care is greater in this community than in many others in Louisiana. Other strengths and opportunities of this community include the increase of patient care shifting from hospitals to non-acute facilities, and the fact that these non-acute facilities are providing residential and non-residential care, which is allowing for more patient-specific treatment. Throughout research, I have found that some of the weaknesses and threats of the community regarding non-acute care include lack of compliance of the patients, understaffed facilities, and lack of transportation to these facilities. Some other weaknesses and threats of the community that I have found include the COVID-19 pandemic, which is causing short staffing, supply chain issues, overcrowding in facilities, and financial distress for these facilities and patients. Another threat I have found is overcrowding due to Hurricane Ida. I found through my interview with Heritage Manor that more than 30 residents and 15 staff from a sister facility housed in their nursing home during Ida, which caused severe overcrowding. These are my references. I hope y'all enjoyed my presentation. Thank you.